I'm Dr. Carlos Guanche. I'm a hip arthroscopy specialist at the Southern California Orthopedic Institute with over 20 years of experience. I'm one of only a few physicians around the country that does complex hip arthroscopic procedures, including labrum repairs, femoral neck resections, bursectomies, as well as abductor repairs and hamstring tendon repairs. In this video, we'll be talking a little bit about hip arthroscopy procedures. Hip arthroscopy is a procedure whereby we're able to get deep into the hip with the use of very small incisions that are typically 5 millimeters in size. In most situations, surgical procedures that used to be performed with very large 5 and 6 inch incisions are now done through these minimally invasive procedures. The ideal candidate for a hip arthroscopy is a patient that has had symptoms including pain and catching in their groin, pain with rotational activities, and an inability to perform sports activities despite having had all of these conservative measures. These include injections, physical therapy, as well as activity modification. Those patients really benefit from the procedure. The advantages of hip arthroscopy include the fact that most patients will come in, have the procedure, which takes about an hour, and go home the same day. They're very active immediately post-surgery, and they're on crutches typically for about 4 weeks. However, they're able to walk on their leg and just limit their rotation, as opposed to the typical open procedures where we actually do the procedure in the hospital. The patient has to stay several days, and they're limited in their ability to get around and really continue on with their day-to-day activities. Once the patient is seen in the office and we've done the appropriate teaching and have provided them with the literature regarding hip arthroscopy procedures, it's simply a matter of making a phone call or speaking directly to our practice coordinator. In these situations, a time will be found for the surgical procedure at the patient's convenience. We usually see the patient a day or two before the procedure to do the preoperative clinic visit and discuss any concerns that they may have regarding the surgical procedure. This is a good time to write down a list of questions that you may have with regards to your particular problem. Most of the time, therapy goes on twice a week for about 3 months. By about the 6-week mark, most patients are riding an exercise bicycle. We start transitioning them at that point to an elliptical trainer and possibly even a treadmill. By 3 months, they get the green light to go back to all of their sports and all of their higher impact activities, such as running and jumping sports. Following the surgery, there are a couple of concerns with lower extremity surgeries. One of them is a blood clot. Postoperatively, we'll have you wear support stockings for a period of 2 weeks, and we also instruct patients on taking 1 baby aspirin a day for the first 2 to 4 weeks, depending on their risk level, in order to prevent a blood clot. Although we allow patients to return to their higher level activities at about 3 months, realistically, most patients, unless they're professional athletes, will really take somewhere in the neighborhood of 6 months to up to a year to really completely improve from these procedures, despite the fact that they're very limited in their invasiveness. To learn more about hip arthroscopy procedures, please visit our website at www.scoi.com. Thanks very much for your attention.